I'm going to begin my self-lymph drainage demonstration by showing you the head and neck drainage for two reasons. First of all, I want to make sure you understand why this area is so important, and you will better understand why these two junctions into the subclavian veins are protected by your collarbone. I also want to make sure you understand why it is so critical to get the sequence, the direction, the stretching of the skin, and the rhythm of your self-MLD correct. For starters, you need to know that those junctions into the subclavian vein are key to your survival. A rather crude analogy would be having your garbage collectors go on strike. You'd end up with a mess, but at least your survival wouldn't depend on it. It will also help you understand why this area is always cleared prior to lymph drainage on any part of the body. Let's make sure you can locate these junctions on your own body. Look in the mirror and roll both your shoulders forward. You'll notice a triangle between your collarbone and your trapezius muscle. Follow that down to the base of your neck or the apex of that triangle, and your middle finger will be on top of that junction. I also want to make sure you understand why it is so critical to get the sequence, the direction, the stretching of the skin, and the rhythm of your self-MLD correct. So let's begin. We'll begin by using the flat pads of our middle fingers, gently stretching the skin from your trapezius down towards the apex. Lift and go back and do it again, at least 5 times. Remember that you're stretching the skin down but not dragging it back. You can ride the skin back if you can do that without pushing the fluid backward. Be gentle. You will be passing over several lymph nodes as well as your internal jugular vein and your carotid artery. Be rhythmical, not too fast, or you will put the lymph vessels into spasm. Duplicate the body's natural rhythm, or think of ocean waves if that is helpful. I had someone get off my table after a treatment and say, "Can we do that again? I don't care if you didn't move any lymph fluid, I just want to go back into an alpha state." Once you've cleared this area, you are now ready to clear your neck. So think about this. You have at least 160 lymph nodes in your neck, filtering out the toxins that enter your eyes, nose, and mouth. All the more reason to pay attention to this area. So start your neck MLD at the base of your neck and gradually work up into the base, all the way up to the base of your ears. With each stroke, you are stretching downward into the triangle. The next area is just under the mandible or your lower jawbone. So stretch the skin from the center of your chin over to the point where you stopped your neck drainage. These are called the mandibular nodes, and you may have noticed they work overtime when you have a sore throat. If you have a cold or sore throat, you can often feel them. Just leave them alone because they're doing their job. I like to complete that stroke by extending all the way down my neck into the triangle. Notice that I'm always clearing into pathways I have already cleared, and I find it is more efficient to clear one side at a time. You can use both, but to start, I just do one at a time. We'll be using a different hand position as we drain the lymph nodes in front of your ears. The pre-auricular nodes, as well as the occipital nodes behind your ears. You have lymph nodes in front of your ear called pre-auricular nodes, as well as behind your ear at the base of your skull called occipital nodes. You can clear both sides at the same time. Just spread your fingers apart. 3 fingers in front of your ears and your index finger on the occipital nodes at the base of your skull behind your ears. Just pump, gently pulling down in only one direction. I recently had a patient whose neck was so swollen he could hardly swallow. No one had ever shown him how to do MLD, and he was desperately trying to reduce the swelling himself by grabbing the tissue and twisting. Needless to say, it was only making matters worse. Once he understood the direction, the rhythm of his strokes, and the pressure, it was exciting to see just how quickly his condition improved. Knowing how to drain this area can be very helpful for head and neck lymphedema, as well as relieving upper respiratory conditions, even sinus congestion. I love showing this technique to ladies who are mainly interested in minimizing the bags under their eyes or puffiness in their cheeks, or on their way to get a facial. It is also extremely important to do this technique on the entire neck and face prior to any facial surgery. As you look on the chart on my left, you can see the direction you'll need to take to clear the entire face. Notice I'm draining into areas I've already cleared, and that applies to manual lymph drainage for every part of the body.